health really is. It's a trust. It is a trust between the government and the people. There have been numerous public health advances throughout time. Each civilization and era had their own method of treating infectious disease that afflicted populations and transcended socioeconomic statuses. Methods of public health to combat infectious diseases vary from proper sanitation practices, improving living conditions, and the introductions of vaccines. Although vaccines have been proven to be the effective public health tool, there is a lot of controversy surrounding the administrations of vaccines, especially to young children. Today I will be discussing how vaccines are a safe and integral component of maintaining public health. Vaccines were founded in 1796 by Dr. Edward Jenner. They were preceded by a primitive procedure called sterilization. Sterilization was the process where healthy individuals were exposed to diseased tissue in order to combat the illness, smallpox. Although sterilizations occasionally resulted in death, it was successful in causing mild illness due to those who underwent the treatment. Sterilization ultimately lowered the rate of smallpox among the population that tried it. After Dr. Edward Jenner discovered the modern vaccine, he was able to spread the technology throughout Europe and the United States. From Dr. Jenner's initial vaccine, there were several modifications made to fight disease worldwide. By the end of the 1920s, there were vaccines for diphtheria, tetanus, whooping cough, and tuberculosis made available that were crucial in reducing the number of deaths caused by the disease around the world. Vaccines were beginning to prove that indeed they were a valid method of preventing public health. Since then, smallpox has been eradicated from the world, and polio is close to being eradicated due to the introductions of vaccines on a worldwide scale. Also, measles, diphtheria, and whooping cough cases are at a record low. Vaccines have also been created to combat the human papilloma virus, HPV, which is a virus that causes cervical cancer. Before its proven effectiveness, vaccines have been integrated into public health via mandatory vaccinations scheduled for newborns, children in school, careers where vaccines are required, and global traveling. Due to vaccination being so integrated into our lives, there is a concern that they are not safe or may cause temporary side effects such as headache, muscle tiredness, or more long-term effects like autism. The Center for Disease Control and Prevention does not state that each individual's body reacts to vaccines differently. They are not 100% safe or effective. However, the CDC does promote that vaccines are the best defense available to fight infectious disease. This is due in part to the fact that there has been no concrete proof that vaccines do cause autism or other long-term related issues, and that the benefits of vaccines outweigh the risk. To ease public worry related to vaccines, it is important to be informed about the benefits and measures that are taken to ensure vaccines are safe and beneficial to the overall public health. Before being made available to the general public, vaccines approved the Food and Drug Administration, or the FDA. Manufacturers must extensively test the vaccines to ensure their safety and effectiveness. Researchers first predict how the vaccine will interact with the immune system. Then the vaccine is tested on mice, guinea pigs, rabbits, and monkeys. Once the vaccine passes the laboratory test, it is tested on volunteer human subjects that understand the possible risk by participating in a 3-phase study. This entire process takes at least 10 years and must be completed before the vaccine can be considered for a license by the FDA that will allow for the vaccine to be used by the general public. Once the vaccines have been accepted for public use, measures are taken to protect the environment post-vaccination. First, a surveillance system, the Vaccine Adverse Event Reporting System, the VAERS, has been established to monitor delayed reactions following vaccination. A second measure that the FDA takes great care to make sure that vaccines and their manufacturers allow the appropriate regulations in ensuring the general public's safety. This includes samples of the vaccine and test results being submitted to the FDA because of how sensitive vaccines are to environmental factors such as temperatures. Since integrating vaccines and immunizations, there has been global impact to the public. For example, due to 95% population immunity caused by a 2-dose vaccination regimen, there has been significant progress made in eliminating measles in 4 out of 6 regions monitored by the World Health Organization. It is estimated that vaccines prevent almost 6 million deaths worldwide on an annual basis. Vaccination also reduce disease among those who are not immunized through herd protection, which is when a significant portion of the community is immune to a disease due to the vaccination and therefore reduces the spread of the infectious agent. Today I have discussed with you how vaccines are a safe and integral component of maintaining public health. Vaccines will continue to be important in the future, and developments are being made that will make vaccination more convenient for use and administration. Information is made available for parents who are concerned about the side effects for a vaccine that will be administered to themselves or their children through the CDC provides detailed information on vaccination and immunizations website. While most vaccines are not mandatory for demographic and it's up to the individual or parent of the child in question whether the immunization is administered, it is important to note the benefits of vaccinations. Vaccinations are not 100% perfect, but they are the best method available in eradicating, eliminating, and controlling infectious disease. In the medical field, it is mandatory for everyone to receive the flu shot. However, if you do not receive the flu shot, you are required to wear a mask for 6 months.